In this video, we're going to talk about diabetes. I'm going to go through the most important things that you need to know about the causes of diabetes in cats. And later, I will also share with you what you can do at home to help identify diabetes in your cat. I have another video that will cover treatment and prognosis of diabetes in cats, as well as talking about diabetic remission. Diabetes is a really common condition in cats. It usually occurs in middle-aged cats from the age of about 6 to 7 years of age. Diabetes in cats has a lot in common with type 2 diabetes in humans. So if we think about diabetes in humans, we usually see type 2 diabetes in people who are overweight or who have a relatively unhealthy lifestyle. The same is true in cats. When cats get diabetes, they are usually overweight and they are quite often sedentary. We also think that Burmese breed cats also have a slight predisposition to be diabetic compared to other breeds. And we think there is also a genetic predisposition for diabetes because not every overweight cat will go on to develop diabetes. And some drugs can also make it more likely that your cat will develop diabetes, but really only if they're already predisposed to developing the condition. Diabetes in cats, similar to type 2 diabetes in humans, is a result of a deficiency of insulin. In cats, this is actually a relative deficiency of insulin because diabetic cats still produce insulin, at least in the beginning of the disease. But being overweight means that you have a higher requirement for insulin, simply by being overweight. So what happens is that you still produce insulin, but it is not enough to counteract being overweight. So as a diabetic cat, you need additional insulin. Now there is a caveat because this is really only true in the beginning of the disease. If your cat has untreated and uncontrolled diabetes, the pancreas, which produces insulin, becomes exhausted from trying to produce more and more insulin, and it may never recover from that exhaustion. These cats may then always require insulin and may remain diabetic for life. There is a second and much less common cause of diabetes in cats. This happens when the pancreas does not produce insulin at all. And this usually happens in older cats who have a history of inflammation of the pancreas called pancreatitis. I have made a video on pancreatitis that is on my website if you want more information. These cats always require insulin, and they do not have the same ability to go into diabetic remission because the problem is with the pancreas. These cats are usually not overweight, in fact they're often underweight, and the diagnosis and treatment of diabetes in these cats is the same with any other cat. The most common clinical signs of diabetes in cats are increased urination, increased drinking, and increased appetite. It is also very common for your cat to rapidly lose weight despite a good or even increased appetite. And many diabetic cats may also have a poor coat, and some may feel lethargic or weak. Diagnosing diabetes in cats is fairly straightforward. A physical exam and a history usually gives your vet a strong clue that your cat may be diabetic, especially if they've been overweight and have lost a lot of weight recently. Confirmation of diabetes is with a blood test. An initial blood glucose can be measured, and if this is normal, it will rule out diabetes in your cat. But if it is high, it does not mean that your cat is diabetic, as many cats get stressed at the vet and may have high blood glucose readings in the consult room. So if your vet finds a high blood glucose reading, there is a confirmation test that can be run. This is something called fructosamine. If your cat has a high fructosamine, it means that their blood sugar has been high for a period of time, not just in the consult room at their visit, and this means that your cat is diabetic. Your vet may also want to take a urine sample to check for glucose in your cat's urine. Diabetes is a very common condition in cats that is relatively straightforward to diagnose. If you suspect that your cat may be diabetic, please do not delay bringing your cat to the vet because this will delay treatment. We briefly touched on it in this video, but in my video on treatment and remission of diabetes, I'm going to explain more why it is so critically important in cats to not delay treatment. I have more resources on my website, allcats.co.uk, and if you have topics that you would like to see a video on, please let me know and I will be happy to make one for you. See you in the next video.